Allergies in dogs. Allergy is a reaction of the body's defense system to an unsupported substance in the environment that the dog would normally tolerate. The most common allergy is caused by an environmental allergen, atopic dermatitis, and food. The dog can also suffer from a contact allergy. The cause of the allergy is sometimes impossible to establish in dogs. Allergy in dogs presents itself in the form of itching and inflammation of the skin. Environmental allergy is a chronic disease that requires individual treatment and allows the dog to live as well as possible with as few symptoms as possible. The goal is to allow the dog to live well despite his illness and to avoid chronic skin conditions. In case of food allergy, the symptoms of the dog can be completely eliminated if the master and the veterinarian find a food that the dog supports or if they manage to avoid the food that he does not support. Symptoms of allergies in dogs. The most common problem in dogs with allergies is itching. These most often occur in the following places: the face, ears, armpits, the groins and around the anus. Some dogs only have recurring problems with ear infections or chronic problems with the tips of the legs. The dog may also show other symptoms. He scratches himself, see murder, bites, licks himself and drags his behind on the ground. The skin presents varying degrees of inflammation, redness, scabs, pigmentation, dandruff, hair loss and infection. Diagnostic. In order to diagnose an allergy, the veterinarian takes into account the various symptoms and coat changes and rules out other reasons for itching such as parasites or skin infections. Step 1. Determine if the dog has a food allergy. To find out what type of allergy the dog is suffering from, we proceed to an elimination diet which will be followed by a reactivity test. Elimination diet in dogs. Definition. The dog must follow an elimination diet for about 8 weeks. The diet should include new protein and carbohydrate sources. Currently, dogs are most often fed hydrolyzed and special foods available from the veterinarian. These are fragmented foods in order to avoid any reaction of the immune system against the proteins. An elimination diet should be strict and the dog should eat only selected foods. Even chewing bones are to be avoided. Objective. During the diet, about 8 weeks, the objective is to heal skin problems and possible ear inflammation. Where can I find this type of food? For an elimination diet, either the dog's master obtains supplies from a veterinary clinic, either the dog's master opts for a household ration. If a household ration is applied, the ingredients must be carefully selected and must not contain ingredients that the dog has already eaten. Reactivity test. In order to ensure that the dog really has a food allergy and that the improvement, cure comes from the treatment, the reaction is induced by giving the food that caused the reaction. During a reactivity test, the dog reacts normally after 15 days, but a reaction is most often visible after a few days after ingesting the food that it does not support. Second step. Allergy blood test. If the food responsible for the allergy is not identified, the next step is to do an allergy skin test or blood test. Allergic reactions to different substances are tested, such as dust mites, pollen, mold. Objective. The objective of the test is to avoid contact between the dog and the allergen and to perform hyposensitization, also called allergic vaccination, or immunotherapy. Treatment of allergies in dogs. The treatment of a dog with an allergy depends on the symptoms, their degree of severity and the complications and abilities of the animal. It is necessary to try to avoid what the dog does not support, especially if it is about a food product or a changing element in its environment. Part of the treatment is medical in the form of tablets or capsules of cortisone, cyclosporin or another anti-allergic drug. Many dogs are treated with allergic vaccination. A treatment containing the substance to which the dog is allergic is administered by the owner in the form of a vaccine or a spray in the mouth. This type of treatment is well accepted by many dogs and has few side effects. The purpose of the allergy vaccine is to reduce the intake of other drugs. Most dogs also undergo external treatment with shampoo or spray. The important thing is to prevent bacterial or fungal infections that make itching worse. The dog must be washed often, every day or every 2 days at the beginning, then the washes can be more spaced out when the allergy is better controlled. The shampoo has different qualities. It can be antibacterial, anti-itch or anti-dandruff. The shampoo must be used correctly and left for between 5 and 10 minutes before being rinsed out. Rinse well to remove all shampoo. Many dogs need regular ear treatment with cortisone drops to prevent ear infections. The treatment also includes a supplement of omega-3/6 fatty acids so that the skin regains all its qualities, because that of an allergic animal is less effective. Fatty acids are also found in food for allergic animals. They produce a calming effect. Results: the vast majority of dogs show fewer symptoms with proper care and treatment. We must not forget that an allergy is a lifelong disease. Dialogue in close collaboration with your veterinarian is essential to obtain the best treatment for your dog. The owner's responsibility is to take care of the dog according to the veterinarian's instructions and to seek help if the symptoms change, worsen, or if the itching is not sufficiently relieved.